When I first thought about my 5-year plan after completing my Bachelor of Nursing, I thought I would be a nurse in a hospital, working on a ward with patients. After doing some research, I've figured out that nursing can take you in so many different directions, doing different roles and in different areas of nursing. After doing some research, I found out that my career is really only just beginning, and it can go in all different areas, and I'm very excited about that. So where does my career begin? At the moment I'm applying for graduate years. I'm a third year nursing student, so I'll be doing a graduate year hopefully next year in 2017. A graduate program I'm really interested in is the one at the Royal Children's Hospital. It's a 12-month program on the Sugar Glider ward, and that is a ward that is a general paediatric ward. It will help me expand my knowledge, grow my skills, and also help me gain some confidence as a new nurse. Another graduate program I'm very interested in is the one that they have here at the University Hospital Barwon Health in Geelong, in my hometown. It's a 12-month program with 2 6-month rotations. So the first rotation, my preference would be a general nursing medical surgical ward. This would mean I have the ability, the chance to really expand my knowledge, grow my skills, put theory into practice, and gain some confidence. The second half of my graduate year, I'd love to be given the opportunity to work on the children's ward. I'm interested in becoming a paediatric nurse. People go, why would you want to be a peds nurse? It can be very heartbreaking, but I think that not only are you providing nursing care to your patient who is scared, not feeling the best, and very anxious, probably doesn't understand what's going on, but it's also my role as a nurse to provide that care and knowledge to their guardian, who is also in an unfamiliar environment, probably scared and anxious for their loved one. My second year out of nursing, I would love to do a transition year, so working in the specialist area of peds and expanding my knowledge and gaining some experience, hopefully in emergency, acute care and special care nursery. For my third year out of uni, I'm interested in completing a postgraduate in neonatal intensive care, which is a 12-month program. Within the NICU and special care nursery, these babies can either be born premature or full term and requiring medical assistance such as intravenous therapy, respiratory support, specialised feeding, incubator, ventilation or minor surgery. La Trobe University and the University of Melbourne are 2 Victorian universities that offer the neonatal intensive care graduate program, and there are many hospitals around Victoria that offer employment in alliance with the program. So with acceptance into the program, those hospitals are the Royal Women's, the Royal Children's, Barwon Health, Mercy Health, and they offer those positions in conjunction with completing your graduate studies. So my 4th and 5th year out of university, it seems like a lifetime away, but I know the time will fly. I'd love to be working within the area of special care nursery and neonatal nursing, putting my extensive knowledge and practicing my skills within this specialised field. The children's ward at Barwon Health University Hospital is amazing, and we are so lucky to have it in Geelong. There's also the butterfly wing at the Royal Children's Hospital, which is the home for neonates, and they are affiliated with the Royal Flying Doctors and their program called Piper. This is the Paediatric Infant Perinatal Emergency Retrieval Service, and that is working with within Victoria, Tasmania, South Australia and New South Wales, either retrieving neonates or taking them back to their hometown, to their community. The Royal Flying Doctors is also an area I'm interested in working in the future. In one of their GP nurse clinics in rural Australia. They also do health promotion and emergency retrieval services as well. There's also CareFlat, which is another aeromedical charity, which is a rapid response critical care. And later this year, I'll be actually heading over to Cambodia with Challenges Abroad, doing health promotion and nursing aid with children, which is something I'd love to do again in the future with organisations such as the Red Cross or something like that. But I think at the moment a graduate year would be fantastic. I'm very excited to start my new career and actually see where it takes me.